Hello everyone. Today I'm going to be talking about optimal EMS care for transgender and gender diverse patients. So a little bit about my background. I am a pediatric psychologist at Nationwide Children's Hospital. I work with the Thrive team here, which includes kids with differences of sex development, where children are born with a difference of their genitals or internal sex structures. I also work with kids with very complex urogenital issues. And then the third arm of our Thrive program is our gender clinic, where we see children and adolescents who do not feel that their assigned gender reflects who they really are. I mention the other two groups of Thrive because we do see slightly higher rates of gender diversity or gender changes in those populations, although the vast majority of people with a DSD do not also identify as transgender, and the vast majority of transgender or gender diverse persons do not also have a history of DSD. Our Thrive Gender program includes mental health providers, endocrinology, and adolescent medicine, but most are only meeting with behavioral health. So the learning objectives for today will be to distinguish between sex, gender identity, gender expression, and attraction, to discuss the spectrum of treatment options and common medical and mental health concerns, and to review affirming and accepting approaches to patient interactions and some pitfalls to avoid. So as a primer for today's discussion, we're going to use the genderbread person chart. So sex is a label that's typically assigned at birth on the basis of genetic makeup, typically XX or XY, and external genitalia and internal reproductive structures. Again, this is a little bit different when we're dealing with DSD. So when people have a gender reveal party before birth, what they're really having is a sex reveal party, because what you're revealing is either that you had blood work done and you came up with XX or XY or something else, or you saw a phallus or didn't on the ultrasound. So really you're having a sex reveal party. So gender identity is an internal sense of who you are, and it might be male, female, something in between, or neither, and it can be fluid or change over time. Gender expression is more so the way in which we show gender through our appearance or social roles. So think of what we sometimes call tomboys. So they're people who identify as tomboys don't necessarily see themselves as boys. They may just prefer activities that are stereotypically thought to be more male in our culture, and prefer to dress and appear in less feminine or more gender-neutral ways. Sexual orientation and gender identity develop separately and are not necessarily related. So gender identity is who you go to bed as, and sexual orientation is who you go to bed with. So for instance, if someone was anatomically born a male, won some gold medals, got married a few times to several women, had a bunch of kids, then had a reality TV show career, and then transitioned to an affirmed female, and if they were still attracted to and having sex with women, they might then self-identify at this point as a lesbian. So how does gender develop? By age 2, most children become aware of physical differences between boys and girls, and around age 3, they're able to actually label themselves as a boy or a girl. Some might go through a phase where they're kind of trying out different genders or different gender roles, whereas others who are considered transgender are persistent, insistent, and consistent over time in their assertions of not feeling like their assigned gender from birth. Studies have shown that the average age is around 8.5 for recognizing that their gender is different than that assigned, although it can be as young as 3, And again, just because they recognize that does not necessarily mean that they're going to disclose that at a certain time or at any point in their life. The current prevalence of gender diversity is thought to be about 0.7% of adolescents and young adults. And that does sound very high, and it is very high, although we also know that roughly a half of those who identify in adolescence as gender diverse will at some point revert back to their assigned gender at birth, or desist versus persist, which is why there's lots of careful consideration that's given before starting any actual medical interventions. So to give you a little flavor for what a child with early onset gender identity changes who does have a clear case of persistence, insistence, and consistence over time, I'm going to show you a book read by Jazz Jennings that's actually read by her.
Hello, this is Jazz Jennings, and I am going to do a reading of my book, I Am Jazz. I am Jazz. For as long as I can remember, my favorite color has been pink. My second favorite color is silver, and my third favorite color is green. Here are some of my other favorite things: dancing, singing, backflips, drawing, soccer, swimming, makeup, and pretending I'm a pop star. Most of all, I love mermaids. Sometimes I even wear a mermaid tail in the pool. My best friends are Samantha and Casey. We always have fun together. We like high heels and princess gowns, or cartwheels and trampolines. But I'm not exactly like Samantha and Casey. I have a girl brain, but a boy body. This is called transgender. I was born this way. When I was very little, and my mom would say, "You're such a good boy," I would say, "No, Mama, good girl." At first, my family was confused. They'd always thought of me as a boy. As I got a little older, I hardly ever played with trucks or tools or superheroes. Only princesses and mermaid costumes. My brothers told me this was girl stuff. I kept right on playing. My sister says I was always talking to her about my girl thoughts and my girl dreams and how one day I would be a beautiful lady. She would giggle and say, "You're a funny kid." Sometimes my parents let me wear my sister's dresses around the house. But whenever we went out, I had to put on my boy clothes again. This made me mad. Still, I never gave up trying to convince them. Pretending I was a boy felt like telling a lie. Then, one amazing day, everything changed. Mom and Dad took me to meet a new doctor who asked me lots and lots of questions. Afterward, the doctor spoke to my parents, and I heard the word transgender for the very first time. That night at bedtime, my parents both hugged me and said, "We understand now. Be who you are. We love you no matter what." This made me smile and smile and smile. Mom and Dad told me I could start wearing girl clothes to school and growing my hair long. They even let me change my name to Jazz. Being Jazz felt much more like being me. Mom said that being Jazz would make me different from the other kids at school, but that being different is okay. What's important, she said, is that I'm happy with who I am. Being Jazz caused some other people to be confused too, like the teachers at school. At the beginning of the year, they wanted me to use the boys' bathroom and play on the boys' team in gym class, but that didn't feel normal to me at all. I was so happy when the teachers changed their minds. I can't imagine not playing on the same team as Casey and Samantha. Even today, there are kids who tease me, or call me by a boy name, or ignore me altogether. This makes me feel crummy. Then, I remember that the kids who get to know me usually want to be my friend. They say I'm one of the nicest girls at school. I don't mind being different. Different is special. I think what matters most is what a person is like inside. And inside, I am happy. I am having fun. I am proud. I am Jazz. To all of the kids out there who are hearing this book for the first time, I just want to say that you can be like Jazz. You could be your true self. I know that it's hard living in this world and that sometimes people just don't understand. But if you just stay strong and keep moving forward and just stay true to who you are no matter what, then one day things will get better and you will be able to live your life as your true and authentic self. So always love yourself and always spread that love to the world around you because you are beautiful no matter what.
So just some terms to be aware of. So gender diversity is used to describe people with gender behaviors, appearances, or identities that are different from that assigned at birth. So some terms that might fall under this include transgender, gender non-binary, gender queer, gender fluid, and non-cisgender. So cisgender is when a person identifies and expresses a gender identity that is in fact consistent with that assigned at birth. So there's also male to female or affirmed female, which is an individual assigned male at birth, but they have a gender identity that is female. Female to male, affirmed male, where an individual is assigned female at birth, but they have a gender identity that is male. And then gender dysphoria, which is a psychiatric diagnosis in the DSM-5, where the person feels a sense of alienation and distress due to differences between gender identity and that was assigned at birth. But it's important to note that this is much more so a diagnosis that's based on environmental or social concerns or how the person with the different gender view is living in their society and how society is more so reacting to them, and not necessarily just because they have a gender difference and therefore they have a psychiatric concern. That being said, the vast majority of people who are seeking treatment do have a diagnosis of gender diversity, and that's in part due to insurance coverage issues and also because most of the people that we see are having concerns in some social or environmental aspect of their life related to their gender diversity. So some treatment and transition options. First and foremost, most people, especially youth and young adults, utilize behavioral health to help work with their family and social environment towards acceptance. And this might include socially transitioning, so moving, like using a name that is consistent with your affirmed gender and then moving more into that role socially, so dressing that way, again, having name and pronouns be correctly used and everything. And some might start to go stealth, which refers to people living in their affirmed gender in public without the public knowing that they're also someone of transgender experience. Moving on to the medical side of things, we have gender-affirming puberty blockers and cross-sex hormones, and then there are gender-affirming surgeries, both top and bottom. And then there's also the legal affirmation process of transitioning. And some people may go through all, some, none of these options. So in terms of medical treatment for peripubertal patients, the goal is to use puberty blockers to relieve psychological suffering that's caused by the development of secondary sex characteristics when you do go through puberty. So kind of putting a pause on puberty allows the adolescent time to make a balanced decision regarding whether to undergo actual medical gender-confirming treatment with cross-sex hormones or surgery, and to make social passing in their experienced gender a little bit easier. Cross-sex hormones are used for adolescents typically aged 15 to 16 years of age and older who continue to persist in their gender dysphoria. And then people aged 18 or older may have the option to undergo top or bottom surgery. although some places now are doing breast surgeries at age 16 or 17. So cross-sex hormones are carefully titrated up to monitor for side effects, but you can see some pronounced differences fairly quickly. And a lot of times the patients and sometimes families that we see really come into our program wanting to move straight into using hormones because you can see such a pronounced difference so quickly. But these hormones are not without their risks, which is why we're pretty cautious when we do start to put people on these hormones. So first and foremost, patients are counseled about fertility risks and are encouraged, if they want, to bank their semen or oocytes before starting treatment. Most choose not to, though, because of not only cost, but also because it would mean becoming a parent sort of in a different role than in their affirmed gender role. But some do choose to do that, and there are certainly some news stories out there about them. Hormone treatment can also, rarely, but can also lead to certain types of cancer, and estrogen can be related to the development of blood clots, which might be useful to know if you're running on someone. Transgender and gender diverse patients have high rates of certain mental, physical, and social issues. So the number one thing that we're most concerned about is the very, very high rates of suicidal ideation and suicide attempts and completions. They also have increased rates of anxiety, depression, eating disorders, which typically is related to trying to lose or gain weight to create a more masculine or feminine appearance, or to try to stop puberty and menses. There are also increased rates of homelessness, physical, verbal, and sexual abuse, and very high rates of HIV. Roughly a quarter of transgender adults avoid medical care for fear of how providers will react. And about 30% say that none of their medical providers know their status. So in other words, they've gone stealth with all of their adult medical providers. So their medical providers don't know that they are not their affirmed gender. And they do this more so for fear of how they will be treated if these professionals know their history, because we know that stigma and discrimination rates are high. So not only are they trying to hide to avoid harassment, but there are very high rates of violence perpetrated against this community. So in Ohio, we had the case of Leila Alcorn at the end of 2014. So she was a 17-year-old from Kings Mill, and she came out to her family as transgender, and they sent her to a Christian-based conversion therapy program. Conversion therapy has since been banned in 6 cities in Ohio, including in Columbus. And her suicide note before she walked onto 71 in front of a semi said, "My death needs to mean something. My death needs to be counted in the number of transgender people who commit suicide this year. I want someone to look at the number and say, that's fucked up, and fix it. Fix society, please." We know that family support is really the single most important factor in decreasing suicidal ideation and attempts. One study in Ontario suggested that only 4% of transgender adolescents attempted suicide if they were in supportive families versus 60% in non-supportive families. So that's a pretty big difference. So I'm going to show you a brief video on affected persons sharing their negative experiences with healthcare as a gender diverse individual, to talk about some of the pitfalls to try to avoid.
My name is Leo Sell, and my pronouns are they, them, their.
My name is Sophia Stanford, pronouns she, her.
I'm Gray, and my preferred pronouns are he, him.
Robin Kanauerhasa, and I use feminine pronouns, so she, her, hers.
My name is Luke Jude, and I prefer he, him pronouns.
My name is Chloe Flora. My preferred pronouns are she or they.
99% of the time when I go to the doctor, I'm anxious and nervous.
Even though insurance and driver's license and everything says female, you really don't know what to expect.
Yeah, I don't think I know any trans person that went through the medical system and had a nice time with it. Not in this country.
I haven't gone to the dentist in 4 or 5 years because it's just such an uncomfortable experience.
I know people who, if they sprain their ankle, will just wrap it up and put some ice on it rather than going to the ER and having an x-ray done because it's just not worth the stress.
I've had a history of urinary tract infections. It was pretty commonplace for me. And I went to the urgent care, and the physician on staff that I was dealing with kept telling me over and over how atypical it was for a man to be having a series of urinary tract infections. I tried to interrupt him and say, I understand, I've been through a gender transition, so my anatomy is probably not what you expect it to be. And he kept stopping me. He wouldn't let me complete and assuring me that he did understand. And he said, I think I would like to take a look. So I pulled down my pants. And it wasn't at all what he expected, and he was immediately apologetic. He said, you don't have, I'm so sorry, I didn't realize. I said, I know, we tried to tell you.
I initially knew I identified and felt female around 5 years old when this was caught out by my family member who was the director of mental health for the state that I lived in. Essentially required forced correction, like invasive hypnotherapy, corrective assignment, and orientation to gender roles, other things to help masculinize and or reprogram the viewpoint of the world to the child. If I had to be this way, I'm going to walk in front of a car and I'm going to reset it and try over. That's what I thought when I was 6.
I had a bunch of different symptoms tied to sleep, tied to appetite, weight gain, mood that had sort of increased in severity over a year. And one of the things that my doctor told me to do was check myself into a hospital next time I had my round of symptoms. So I checked into a hospital, and even just within the check-in process, I was misgendered. I finally spoke to the doctor, and he came in and was speaking to me as if I was a 13-year-old girl. And all of my symptoms were surrounding hormones. And when I started talking about hormones, this doctor in the hospital actually looked at me and said, what do hormones do? I didn't think hormones did anything. And he actually checked me out of the hospital. He said, I think that you're just bleeding a lot right now. Fast forward 3 days later from this hospital visit, and I was diagnosed with invasive hormonal breast cancer that tested 99% positive for estrogen. And I think that if I had had the same list of symptoms, but was a cisgendered man, I would have been treated completely differently.
So in general, I've been blessed with a good primary care physician and an endocrinology doctor, but I was seeing a specialist for a different medical problem, and my records and everything all said female. I have everything changed. And the guy looked at it, he went through all of those steps, and then said, so, do you dress full-time as a woman? And I was stunned. It's like, do you dress full-time as a man? Yes, I'm a woman. I'm a woman of transgender experience. And of course, it's just like any other woman in your office.
The biggest horror story that I had was going to the pharmacy to pick up my first testosterone prescription. I was nerve-wracked already because it's like such an emotional thing to like finally get that golden ticket. It ends up being like $1. So it's just the syringes. There's no medicine. 4 people later, and about 20 minutes, they finally look it up in the computer and they're like, oh yeah, oops. Throughout this entire process, I have to say my legal name, which isn't the name that I go by, out loud to the entire store. And I'm basically outing myself to everyone around me. And that's not wanting to hide, that's just about trying to stay safe. Like, some people hear that and they might follow me to my car and bash my head in.
During one physical therapy appointment, I had one of the therapists misgendered me to an entire room of people, both other physical therapists and other clients. He never looked me in the eye again. He never talked about it. He never apologized. It was just this weight. And especially me as a trans woman, I get misgendered all the time. Like, it's something I deal with on a near daily basis. So to have that happen in a medical setting, something where I can opt out of, even though it might not be the healthiest thing, I will. I'd rather protect my own sense of mental health.
So I asked some of my Nationwide Children's colleagues about some stories they've heard from patients regarding some negative medical experiences in our general catchment area. And so they told me stories about patients they see who have been repeatedly misgendered, so not using preferred name or pronouns, even when they've heard what the preferred name and pronouns are. Asking questions that the patients didn't feel were necessarily medically relevant to the issue at hand, and what they perceived to be being asked more so out of curiosity. And then expression of shock when finding a genital that they weren't expecting. And then several of our Nationwide Children's patients reported that they were refused care due to the beliefs of the provider. So conversely, here's a story about a positive impact that medical care can have with affirming patient care. My 14-year-old son is transitioning, and we informed his doctor that we would like them to include his name and pronouns in his chart. Last night we had to go to the ER because his finger was infected and the antibiotics had not helped, even though they cleared up another infection on his earlobe. He was in a lot of pain and really anxious, but they immediately used his name and pronouns, and it might not seem like a lot, but it made my son a lot more able to trust the people who were about to stab him with needles and cut him open. He has a hard time trusting doctors because they misgender him. When they started off treating him like who he is, it really formed a good basis for a doctor-patient relationship. My son has been to the ER quite a few times in his life, and this was the only time he didn't hate it and feel as if he couldn't trust or be helped by them. So transgender rights have been in the news a lot over the past few years. Lots of stories about bathroom rights in schools and rights of transgender service people in the military. Many airports and larger buildings are now starting to have all-gender restrooms, and legislation on a state-by-state basis are changing to include options for gender non-binary identification on government documents and IDs. And some businesses have also started to take notice. So just this week, I noticed that United Airlines now offers an option for unspecified and undisclosed gender. Many clothing stores, particularly children's clothing stores, are producing options for gender-neutral clothing. And some toy stores, such as Target, are starting to have gender-neutral toy selections. So this is not only to accommodate gender non-binary kids and families, but I think also in recognition that we as a society maybe don't have to be quite as rigid in our defined gender roles. So the legal affirmation process can vary from state to state, but in Ohio you have to submit a petition for a name change to the court and publish notice in a local newspaper at least 30 days before your hearing, unless you are able to show a real risk to your safety in doing so. That is a requirement to publish in a local newspaper. And then for gender change on an Ohio ID, you have to have a physician or a psychologist sign off on your paperwork. So if you want to change the ID on your driver's license from male to female, you have to have a physician or a psychologist sign off on it. In Ohio, gender can only be noted as male or female. In some other states, you're able to put in X or something else. Ohio will not allow for changes in gender on the birth certificate. Many other states will. So, in summary, there are lots of steps that people have to take to legally change this information. So I think it's important to note that just because someone's legal documentation, their driver's license or their insurance card might have a different name or a different gender, that does not mean that the same rules do not apply, where you should go by what their affirmed name and gender is, regardless of what their paperwork and documentation might say. So some take-home points are that transgender and gender diverse identities do not necessarily mean that they have a mental disorder, although we do want to be aware of higher rates of suicide in this community. It's important to always ask for and use the preferred name, and when in doubt, ask for preferred pronouns, and if it becomes too complicated for you, then just keep using their preferred name. It's also important to try to explain why you're asking the medical questions that you are, so that they can really understand why you're asking them and not think that it's coming from a place of curiosity or exploitation of their condition. It's important to maintain confidentiality, of course, with all of our patients, but even more so with this population because of the risks of violence and discrimination that they experience. Remember that people can be in different stages of transitioning, both physically and then also in terms of paperwork. And please remember to document in a respectful tone that affirms the gender identity of the patient. So thank you all so much for listening to me. And if you guys have any questions or concerns, please feel free to reach out. Thank you again so much.